Obviously, the dangers of COVID-19 for individuals in long-term care facilities seems to be well documented and understood. But there are some specific questions, some specific concerns about folks with Alzheimer's in these professional long-term care settings. Loneliness, for example, comes to mind. Can you tell us what you're seeing and hearing about Alzheimer's specifically within long-term care facilities? Jackie, do you want to start?
There's been a lot of concern among people who have loved ones in assisted living. Some of the assisted livings have separate memory care units, but the majority of care partners are very worried because they're not able to visit their loved one. They're not able to spend time with them as they normally do, and they're not able to assess the actual health status of their loved ones. Now, I have to say that DAA is a major proponent of using technology. And so a number of assisted living communities have technologies in place so that at least the person who's living there can be shown their family member, like through FaceTime. I actually saw in one community a little robot who's moved over to each of the people living there, and the face of the robot changes to be the family member who's outside, and the family member can then be talking to them, and they can be talking back to the face of their family member in the robot. Then the robot moves and goes to somewhere else. It's better than nothing. The isolation is one of the most devastating things, and we've all heard that. The real problem is that so many communities, Eli, are not yet using technology capabilities to do those kinds of things. And so the isolation, as Brenda says, it really is causing tremendous, tremendous stress and worry and confusion among their loved ones. I did see an article from the Indiana State Department of Health, and the reason I bring this up is because every different state has different regulations. This particular state we were really impressed by because they are very involved in what we call non-pharmacologic strategies for dealing with the virus in memory care units. And what they recognized was that clearly residents wander more, and they recognized that they needed to be able to have more assistance helping the residents. So what they decided was that they would have a specific regulation that family members could be considered like staff members and like volunteers as long as they passed the testing and all before they went into the facility. And it makes such a difference because think about it. Here, instead of being alone and frightened, they actually have a family member being their companion. So to ease some of that stress and to take off some of the stress of the other staff members, at the facility. I don't know, Eli, how many states are considering that, but in terms of thinking about what DAA believes in, we absolutely believe how important it is for every long-term care community to consider person-centered and relationship-based care practices. And I see Brenda shaking her head because that's what we know to be the most help for everyone. But I think that we have a long way to go in terms of thinking about how many states are going to allow different kinds of regulations to help ease some of that isolation, Eli.
Absolutely, Jackie. Sue, anything you want to add with regards to long-term care facilities and what you've been hearing?
Yes, I think that there's a lot of issues going on right now in long-term care settings. The whole issue of reporting COVID-19, which seems like a really basic issue, was difficult at the beginning of this pandemic. Facilities obviously don't want to worry families, but at the same time, transparency is really important. And a lot of families were trying to call to find out how their loved ones were doing. Staff weren't necessarily able to answer the phones. And that creates a really scary situation for families. The Centers for Medicare and Medicaid Services actually released regulations about a week ago, mandating reporting and trying to make it consistent so that we could get as much data as possible across facilities. And this is particularly impactful for people with dementia, because as many as 60% of residents in nursing homes have cognitive impairment, and many facilities specialize in dementia care. So they might have 80% or more residents with cognitive impairment, Alzheimer's disease, other types of dementia. And like Jackie was saying, that can create a rise in, worry, anxiety, agitation, other types of neuropsychiatric symptoms. A lot of times the way that facilities are dealing with mitigation and social distancing is to make sure that residents stay in their rooms. So you're sort of confined to a space that normally you might be able to wander out and do activities, and that can really raise a lot of issues. The other thing I think is going on is it's raising issues around staffing at nursing homes, because part of what they're seeing is staffers oftentimes work in multiple facilities. And so they're being exposed not just to people in their homes and the communities, but to residents across facilities. So if they go to one nursing home that is experiencing COVID, and then they have a shift at another that hasn't experienced it yet, it raises the risk tremendously. And once it enters a facility, the likelihood that it will spread just goes through the roof. So you've heard a lot of horrific stories. I think it's opening up more discussion about what type of resources nursing homes need, and also what type of regulations we need to put in place to deal with these staffing issues. Even, things like making sure nurse aides are paid well. So it brings up a lot of things. One more point that I wanted to raise, Jackie talked about non-pharmacologic interventions, and there's no question that this is going to be testing the skills of folks that work in assisted living and nursing homes to repeatedly remind residents of hygiene, needing to wash their hands. Self-care is oftentimes an issue in dementia, and so the need to remind again and again, and to be patient and kind. And they're under stress themselves. They have their own personal lives, and it's a stressful situation in nursing homes and assisted livings because it's a high-touch profession, and they're not given access to personal protective equipment. It's not even really possible to do the job with that level of equipment on you to bathe people, to transfer people. So there's a higher risk almost than for folks who are working in the direct care settings that we hear about all the time in hospitals and emergency rooms, for people who are in long-term care. So it's raising challenges, I think, all around, but it's also showing a lot of opportunities. So with the issue of the non-pharmacologic, I want to make sure that we also recognize that with this increased stress that everybody across the board is experiencing, let alone people that have challenges with dementia, it's going to raise neuropsychiatric symptoms. And it's important that folks have access to both non-pharmacologic approaches as well as pharmacologic approaches if they need them.
Thank you for that, Sue. I do want to continue that conversation. Jackie, jumping back to you, just wondering, at the Dementia Action Alliance specifically, what new ideas, resources, or solutions are you rolling out to the community specifically to address the COVID-19 pandemic?
Absolutely. DAA service population, as you probably can imagine, encompasses people across our entire country. And so with that in mind, we always knew that we needed to use technology to be able to reach and connect them together. Clearly, we have been doing caring community conversations with speakers living with dementia, and we love that. We love the in-person, but we're not able to do that right now. So we recognize that we've already been using technology, but we were going to up our game. In other words, DAA members with dementia, they've already been hosting weekly discussions, as well as hosting and producing 2 monthly podcasts, one called This Dementia Life, and the other Professional Insights. And with Professional Insights, even though it's the people living with dementia that do the hosting and the producing, they bring on speakers for special topics that both individuals and families are interested in. But we recognize that we wanted to do more. And it's about what Sue is saying, that the whole sense of isolation and worry. And so we decided to bring in this wonderful member of our board of directors, Dr. Susan Weary. She is a geriatric psychiatrist with years of experience in supporting people after like 9/11 and terrible hurricanes and things like that. Every Tuesday afternoon at 4 p.m., individuals and families are invited to come on Zoom and to drop in to talk to Dr. Susan about anything they want to talk about. And because Dr. Susan is so warm and genuine, and I've attended some of these meetings, I realized that they don't want to leave in an hour because there's that comfortable sense of authentic connecting and caring. And I think that we can all agree that that's one of the things that we really miss in this whole isolated experience that we're having. The other wonderful, and I mean wonderful, experience that people can have is on Friday afternoons with Dr. Cynthia Hulling-Hummel. She lives with dementia symptoms, but she is phenomenal. She has been preaching around the country and around the world. She leads a faith, hope, and love discussion so that individuals can come together for friendship, for positivity, for hearing messages of hope and love. And I go there because I get uplifted. So I think that what we're talking about is really trying the best we can to virtually connect and fill up people's hearts and spirits, and in a way that we know is not as good as when we're right there with them, but it's certainly a lot better than nothing.
Thank you, Jackie. That's great. And I do hope that some of our viewers will begin to tap into those resources as well, because they sound like they're absolutely fantastic and can absolutely provide those hopeful messages that so many folks are desperately in need of. At this point, I do want to come back to Mark and Brenda. So we've heard from Jackie some great resources that folks were able to access. Mark, Brenda, you spoke a little bit earlier about how your routines have changed, and not necessarily for the better. You're not being able to partake in your coffee groups and connect with others. But I'm just wondering what new things you are doing to stay well, and what advice would you have for others? How have you perhaps shifted your routines in a positive way?
Well, Right now, Brenda has been trying to get like puzzles for me, and I hate puzzles. I I I work on them. I mean, I used to do in drafting and stuff, but I can't put some of these things together, and they're very frustrating to me. But I have to say, one of the biggest blessings that I have, and that I'm really thankful for, is that I have my dog. And Sophie has filled my heart and has filled me with a lot of joy. We are best buds. We go places. She follows me. I mean, that's her job is not to leave my side. And so she's been in a lot of discussions with me out in the barn when I'm building something, trying to help me out. And it's a joy to take her for a walk. It's fun to be training her. She's just been the best thing that ever has happened to me. Has changed my attitude, has changed the way I look at things. And so that's another thing that has really changed for me. Otherwise, I've been doing bird feeders. I had bought some a long time ago, and then we have made some, and so I never got them up. So now I have been. The boys have stopped and got me posts, and so now I'm putting up bird feeders because I love the wildlife, and I've redesigned my bird feeder, and I'm feeding them year round. And before I didn't do that, but now I'm getting all kinds of really unique. I even had a red-headed woodpecker come in, and so it's been fun. The other thing is my family, my two girls, and living with my children, and then also my other daughter who's 5 miles away. She comes and they sit on one side of the driveway and we sit on the other side of the driveway, and we can have a nice conversation. They like at least once or twice a month they do that, so we see one another. We do contact one another by phone, but it's been a real joy. I am a very, very blessed man, very lucky, and now I found out that I had been a better dad than I ever thought I was, because they love me to death and are concerned about my well-being and Brenda's. So I'm very fortunate, and I thank God for that.
The dog's not the only animal Mark talks to. You could have been Dr. Doolittle. My daughter has chickens and raises chickens and eggs. And so during COVID, Mark used to be involved, but now you really take care of the chickens, right?
Yeah. And I talk to them.
And you talk to them.
Yeah. I make clucking noises.